morning, everyone. Thank you for joining us at our Prestige PEO webinar series. My name is Carrie Kaiser. I'm Senior Marketing Operations and Event Specialist here at Prestige PEO and your host this morning. Today's webinar is all about the challenges of caregiving and how it impacts the workplace. Joining me today is Mim Senf, co-founder and co-managing director of Motivity Care. Our webinar audience members are muted by default. However, we encourage you to make use of the chat feature to pose any questions you may have. We will respond to them towards the end of the webinar, time permitting. If we're unable to get to your question, we will reach out to you shortly after the webinar concludes. Additionally, the webinar is being recorded and will be made available on our website at prestigepeo.com/webinars. And now we'll get started. Welcome, Mim.
Thank you for having us. We are really excited to be working with Prestige and be able to talk about what we think is a very important issue for employers to understand. So before I jump into the data, I just want to ask everybody on today to think about anybody that you know that has had to make caregiving decisions for a loved one. Might be an adult child, a parent, it could be their parents, grandparents, and it may be you. I am not only the co-founder of this company, and as you saw, I have an extensive background in employee benefits design and employee health and well-being, but I have also been a caregiver. And I think what we want to get across here today is when that employee at any level gets what we like to call a tipping point call, it upends their careers and their families, and there is a cost to employers. So this is true for me. I've had several of these personally, and I will tell you that one of the biggest ones that I have ever had, and the most unexpected, was about 5.5 years ago when I was doing what a lot of us are doing, right? We're here in a meeting, organizing a new event, working on a project, and it was a Friday afternoon and a lovely August sunny day, and a call came through, and I thought it might be a prospect. Pick up the call. It was not. That call went like this. Hi, this is the social worker from New York Presbyterian Hospital's ER, and we have your husband here. Okay, is he okay? Well, he can't get to the phone, he can't speak, but we're evaluating him. How fast can you get here? I said, well, I'm about 60 miles away. What do you need from me? They said, well, again, we're evaluating him. We need you to get here as quickly as possible. Keep your phone on, because we're probably taking him into surgery. And as you can possibly, I'm sure you can imagine, it upended my life. It upended my career, and I was now forced to try and balance my career and caring for one of the most important people in my life. This is true for more and more employees, and there is a cost to both the employee that is suddenly thrown into caregiving. There's also a huge cost to employers, and that cost is growing. So we want to share with you today some of what the data is around this to help us help employers better understand why they need to be thinking about this, but also how they can effectively solve this problem. So I've gotten this question multiple times. Is this a public health issue? Well, yes. Is it an employer issue? Yes. And can this potentially be a huge financial crisis? My response to that is it already is. So there's multiple ways for us to talk to employers and employees about this issue, depending on how they view this particular problem. Here's a little historical data for you. So this really hasn't been a huge problem, prior to 2015. But as this data shows you, it's coming, and it's coming pretty fast. And so again, it is going to be incredibly important to try and show employers that if you're going to get ahead of the curve, now is the time to start to think about this. We also tend to think of working caregivers as older people, right? Probably over 50, that's when they're taking care of aging parents. But as you can see here, and I think this is really interesting, we're talking about almost half are between 18 and 49. And as you can see, 24% of those are 18 to 34. So you're thinking, well, wait a minute, they're caregivers to adults. What does that really mean? So I can tell you that we have clients, employer clients, that have had employees as young as 21 come up to us and say, look, I'm the primary caregiving decision maker for my grandmother. Can you help us? Of course, the answer is yes. That's what we're here to do. But I think it's very interesting to also think about it in terms of the prior generation waiting longer to have their families. And so you will have employees that are 30, 35 that may have parents that are 75 and 80. And that's why you're starting to see more and more caregivers at younger and younger ages, which is now going to have an even bigger impact on their career. They're again going to be trying to balance moving up in a company, getting additional education, at the same time managing doctor's appointments, legal issues, just really trying to take care of the people that they love. And this is a pretty immediate issue. So I think it's important to think about not only those that are currently caregiving, but also to get a picture on what this is going to look like in the immediate future. So this data right here that we're taking a look at. This is within the next 2 years. And the difference between being a little bit more prepared and understanding what you need to have in place versus being thrown into it and not having anything in place is where we start to get into productivity issues. When these people need to make phone calls, if they're going to show up late because a caregiver didn't show up. And one more piece of data here. I mean, I think most of us know this, but I think it's good to see this in a global context. If you are working with employer groups that are multinationals or have, again, employees that they're sending around the world, here you go. It is not just the US. It is clearly impacting populations and employers across the globe. So it gives us some really good conversation. But here's the big question, right? How much time does it really take? I mean, do I need to be concerned about this either as an individual or an employer? Well, my question to you is, do any of us suddenly have an extra 24 hours every week to do caregiving management? So think about it through this lens. It's not about necessarily feeding a person or doing the things that we would think about as direct care. This is more about, I've got to call Medicare, or I've got to call the lawyer, or I've got to schedule testing appointments, or the aide didn't show up. I've got to get a food service. I'm not sure who to bring into the house for mom because I just don't know who she normally does, who she trusts, the cleaning lady, the maintenance person. So when we talk about caregiving management, we tend to think in this medical lens, but the truth is caregiving is, you've got to take a whole person approach. And this is why it takes so much time. Keep in mind that if you're caring for mom and dad, if you're caring for an adult special needs child and your husband, the number only goes up. So it's very important to understand what this truly means for that person, that you need to be productive. And if you have already been through this, you already know how complex it gets. Part of the problem with caregiving management is not that there aren't great resources out there. The problem is that it is so fragmented. How do you even know how to vet if you don't have an expertise in any area? How do I decide whether mom can stay at home or whether we really need to be looking for different kinds of living options? How do we protect the money that they've worked to save all these years, and what does that really mean for them? And then, of course, things like medical decisions around hospice. So this again becomes a snowball effect. It's not just the time, it starts to wear on physical and mental health, and we'll get a little bit more into that. So I think this stat is important again to understand. When we're talking about at least 25% of our workforce in the US being 55 or older, the chances of them being a caregiver are obviously higher. And so again, that's going to have an impact to that company's bottom line. It also is going to have a huge impact on whether or not they can save for their own retirement. So as we start to look at this, this problem, I'd ask you to consider these stats and where we think this is going to go in the next 5 years. And here's the big giant number. So we know most of us are either going to be making caregiving decisions for somebody in our life, Or the reality is that if something happens to one of us, who's going to make those decisions for us if we can't speak for ourselves? So I'd ask you to think about that personally. And I was just at a conference last week and we had this discussion with the folks that were in the audience. I said, here we are at a wonderful conference and, we're learning and networking and doing all the things that we do. But if the unexpected happened, if you passed out right now, what would happen? Who has the information that they need? Of course, somebody's going to call, emergency and you might be taken in an ambulance, but are you allergic to anything? Is English your mother tongue? Are there any specific medical needs that really need to be called out for that ER department? Who are the people that need to be contacted? Not just that medical emergency person, but maybe a work person that needs to be contacted immediately. Maybe you need somebody to keep eyes in your home, if you would be away for several weeks. So there's all kinds of considerations that when you are in that emergency situation, one, obviously, if you can't speak for yourself, who's going to be able to speak for you? But also you start to see the benefit of understanding what being prepared for these things, being prepared for, again, that tipping point call or experience that can get you back to the life you want to lead, can get you back on your feet either for you or the person that you're caring for. And this cuts across all demographics. So I know, there's a whole lot of discussion around diversity and inclusion, gender equity. There's certainly been a lot in the news about this recently, but I think we can all agree that we want all our employees, regardless of background, to be able to show up, be productive, be able to contribute. But caregiving is kind of an interesting piece of this because it ties into things like the bias around ageism, right? You've got an older employee, they need to keep working, they don't have enough saved for retirement, and now they're challenged with caregiving. When we look at this through an ethnic or cultural diversity lens, this is very important because certain ethnic groups, you need to be aware that they tend to care for their aging loved ones in their home, which is a different discussion than if you're looking for like a senior living community, independent living, memory care. And so having that kind of understanding of what caregiving means through these different lenses is important. LGBTQ plus, family may be a very different definition of family, and so there may be legal considerations in that particular group of folks that need to be discussed so that they're better protected. There are religious and spiritual components to this that may come into play. Now, I often get asked, why do you put men up here? Right? There are wonderful men that we've worked with that are the primary caregiver to people, loved ones in their lives, their wives, their parents. But interestingly enough, there's a different kind of bias out there. And so when you're talking about caregiving to an employer, I think it's important to understand that men often will get shamed for this, believe it or not. It's women's work. Why isn't your wife doing it? Why isn't your sister doing it? Um, and cognitive diversity, which has become more of a discussion in the DE&I space, it's how they communicate and whether they can communicate. So we're very big on helping a working caregiver get what they need through the lens of their personal background and their preferences so that it can be more effective and so that the caregiver that is making those decisions can really have peace of mind. Gender equity, I think if you're going to talk about this for any company that has a financial wellness program, clear tie into that. Women, this number, when I first read this, was astounding to me. I think about, we always talk about this like women leaving, to take care of children for a year or two and taking that break from their career. But what happens if you take a break to care for mom or dad for Alzheimer's, if they happen to have Alzheimer's or dementia? I had an amazing conversation, well, amazing, maybe eye-opening is a better word, conversation with a woman who was a professional. She had to take 10 years out of her career to care for her mom that had Alzheimer's and a disabled father. And coming back into the workplace, she's starting all over again. She went through all of her savings, all of her 401k savings. So keeping them in the workforce, being able to balance, has a clear impact on your employees' financial well-being. And I think the second stat we think, okay, $10,000. Well, maybe that doesn't seem like a lot to maybe an executive that's making $250,000, $500,000 a year. But think about that through the lens of an employee that's making $65,000 or $70,000 a year. Where are they going to come up with that money? And again, often they're starting to tap into their 401k or whatever retirement vehicle that they have in place. It is clear from the data that we saw coming out of COVID that there is discrimination against caregivers. And I use the expression, although it's not the same, but when we talk about family man versus working mother, caregiver kind of holds the same kind of weight around this. I'd be really curious what anybody's thoughts are, or if they have heard feedback or even thought about a caregiver bias. Do we really think that if somebody is trying to struggle and care for that loved one, not showing up, having to leave at a certain time, trying to make a doctor's appointment with their loved one so that they can hear what's being said, do we think that they're being viewed differently? And the answer, unfortunately, right now is yes, which is why we are big on the education piece. They do bring value. Why would you not want them to stay productive? But we also have to be aware that they're going to need some support in order to do that. So we took this a step lower too. So for those, those folks that are talking to employers about this, it's not just women. There is a whole nother level when we talk about diverse women in the workplace. I don't think it's a surprise for anybody who's seen any of this data that one of the challenges is not just the job, but the second job, the unpaid job that many of us go home to. And so again, recognizing these additional stressors on that employee and how that may be impacting their productivity is something that we need to consider. The second piece of this is, again, we want to reduce healthcare costs, right? I mean, how many of us talk to employers and that's the number one consideration? Okay, caregiving impacts those costs. So there's another tie-in as to why we need to be discussing this. Then there's the turnover costs. Do we really want to lose these folks? And what is the actual cost to our bottom line in terms of recruiting, turnover, training, the hit to the teams that they've had to leave where other people have had to pick up the work? This is just something that needs to have more discussion. And of course, there is what I always call like a heart piece to this. But I think realistically, when we're talking to employers, it's really about the financial hit that they're going to take and making it very clear for them. So much conversation about this, right? Self-care. What does this really mean for our employees? And this is a little bit deeper into the employee benefits cost. So here's a question for you. What percentage of the workforce currently do you think is made up of caregivers? So any given workforce, do you think it's 10% of that workforce? Do you think it's 20% of that of our, on the average of the workforce? And you can put your answers in the chat if you'd like to do that. And I'll give you a second. And as you're doing that, this starts to tie some of the other pieces together too. So there is the higher benefits cost that we're trying to address. And again, it's not every issue. Caregiving and solving caregiving isn't going to, reduce it, for every health issue that employer group may be having. But I'd ask you to consider this. There's been so much discussion about the increase in mental health costs. Well, if you've got a high percentage of caregivers in your workforce and it is causing higher levels of depression, if we put in something that actually starts to address that, not just a lunch and learn, but something that can reduce hours, make it easier, is that going to have an impact on those costs? We think about those lower level employees. This is the group that I really like to focus on because they are the most at risk. And so you think about that person working that 8 hours, maybe they're working 12 hours, maybe they're, whatever they're doing. And even dedicating that kind of time to a company, not being able to save because they're caregiving for somebody, maybe not even being able to pay an electric bill. So again, causing a huge amount of anxiety for them. And I think this last step, because there's a lot of discussion in our world around addressing diabetes costs, which we know is very, very high and only growing. But your working caregivers are going to be even more likely to drive up those costs. So again, a real reason to start to have this discussion. So the answer on average in the United States is that anywhere from 25 to up to 40% of any given workforce is caregiving for an adult right now. Adult child, spouse, parent, grandparent, and maybe multiples. And this is a very good number to be able to share too. I mean, it's kind of scary when I look at this. I mean, and I hope all of us are working hard for our own retirement so that we can get to enjoy an independent retirement and do whatever we want to do. But this is the harsh reality. And so when we have this conversation, it's incredibly important for HR, benefits, and leadership to have a clear picture of this. Again, you can bring in your 401k provider and have a great conversation about how you've got to save and put money back and do all of those things. But if caregiving is the biggest barrier to somebody putting that money away, even a little bit, it is definitely something that we need to think about. I also encourage you to talk to them about it through the diversity lens because there are clearly differences, and oftentimes we miss having those kinds of conversations in a way that makes sense to the people that we're trying to reach. So this is very high level, and it's something that I talk to employers about a lot, and to kind of think about this through three different lenses. Again, are there employees that have older adults living with them? Because this is where you can start to tie it into your dependent care benefits. If the employer does have dependent care benefits, I found, and maybe you have too, that it almost always gets discussed through the lens of childcare, right? You can put back pre-tax dollars. This will pay for care for your child, but it also applies to tax-dependent older adults living in your home. And it's a great kind of webinar to do. It's a great way to enhance another benefit they may already have in place. But I encourage you to think about that with this aging workforce and aging population to encourage employer groups to have more of a conversation around that. In the context of benefits planning and design, which I know a lot of you do, and it was my world for many years when I worked at NFP, it's this integration of benefits. So how do we make sure that an employee that's a caregiver is not just getting the right information around their caregiving journey, but also getting referred over to their EAP if they are not in a good emotional place around this. And again, if you've been a caregiver, you already know, but caregivers can feel incredibly isolated. Some of the calls that we get, it is a shock. Again, somebody just got a cancer diagnosis. Mom has ovarian cancer. They were totally fine. They just had emergency surgery. And the emotional piece of this needs to be addressed as well as the practical pieces. It's important that the question gets asked, are you okay financially? Are you thinking about using your 401k? If you are using that money, please call your 401k provider. Have a conversation about that, understand the tax implications of doing that. But I'd also caution too, it depends on the 401k provider, because again, most of them are very focused on the retirement piece. They're not so educated around what we call a financial care plan and what that really means. All the pieces of the puzzle, what pieces get paid for by Medicare, what pieces get paid if you are able to put a Medicaid application. the differences between having a trust and a will. But all of these things can help your employees do a better job and enhance that total rewards program, make it more effective for your employees. Through the financial lens, again, there are a lot of providers that go out there and give good product information, right? This is how the products work. This is what return you're going to get on this money. But what's very interesting, again, looking at this through different diversity lenses, is that a lot of people really want advice based on their personal situation. And it's something that we really need to consider. Again, if you're going to start talking about this through the caregiver lens or the caregiving lens, what does this really mean for me financially, for the people that I love? How can I protect their money that they've saved for? But I think the other piece of this is how can you start to educate your employees right now to be prepared so that they can age well, age independently, live the life they want to live into their hopefully 60s, 70s, 80s, and have that kind of financial security, understanding all the pieces that might come into play. Things like long-term care insurance. What does that mean? Can I afford it? Why, when should I get it? Is not something that we talk about. And yet it can have, it can be a true gift when you start getting thrown into some of these situations, either for your loved one or for yourself. We are always about expanding this conversation so that we're not just talking about this as a one specific piece. You're going through this caregiving crisis. Most people, again, are going to think about this from a medical lens, maybe a legal lens, but the impact to caregiving on your employees and on your employer groups all ties into a wheel, right? We want people to be able to build the relationships in their team. We want them to be involved. We want them to be healthy, connected to their sense of purpose, and doing all these things. But again, if you go back to 25 to 40% of that workforce caring for a loved one, where is their focus going to be? If they don't know where to go for something, if they are struggling financially, how are they really showing up? And how is that driving benefits costs and turnover costs? I love this stat because, again, it gets more to the bottom line, always about, sharing the business case. So where this really ties in is that caregivers are part of this diversity conversation. And I would argue that there is no C-suite executive that would not like to have a better financial performance, right? So again, this goes back to, yep, sounds nice. Okay, I'm supposed to care about caregivers, but does it really help me in terms of helping my company grow? If it's publicly traded, am I going to outperform my competitors? And am I going to retain the talent that I really need? So I encourage you, if you are going to talk to folks, to think about stats like this. And then I also love to be able to give employers some real practical ways to think about how to measure, right? You can't, again, if we're going to put this in, how do we measure where we are right now in our own workforce? If it's making a difference, are we communicating this the right way? Like with any other benefit? I mean, I know most of us, despite all the mental health challenges, EAPs in general, we still have challenges getting people to use them. So it goes back to helping that employer group really understand how to measure it. So measuring turnover costs, we know from SHRM data that the calculation is basically anywhere from 25 to 50% of an annual salary to fully replace that person who's left. So it's kind of a down and dirty number, honestly. But if you can kind of calculate, all right, well, let's just take 25% of the people that have left the company. Let's look at their salary rates. We can kind of guess that a portion of those are going to be caregivers. This is where you can start to come up with an actual number and say, this is what it's costing us. If we can reduce these turnover costs by 20%, here's what we're going to save. The education for leadership and management, like for any benefit, obviously is very, very important. One of the things, like I did at the beginning of this, is asking them, Asking leaders, have you gone through this? What has your experience been? Has anybody on your team gone through a very difficult caregiving situation? Because now it becomes personal and there's an emotional component to it, and they start to understand what that means. And I can tell you from, again, talking to employer groups, that when there is somebody at the top that's gone through this, it becomes a very easy conversation to have. I'm big on getting some survey data, but again, because of the caregiver bias, you don't necessarily want to ask a direct question. People may not want to identify. So our recommendation around that is to ask, do you know of anyone on your team or within the company that has been caring for an adult, a spouse, a parent, an adult child with special needs over the past 2 to 3 years? Which is good because now they're not identifying themselves, and you can start to get a little bit of a picture around that. And then the other thing is to think about it through the recruiting lens for employer groups. If I am applying for a new job and I'm a caregiver, and we know that there's, again, a high percentage of those folks, and I know that this company actually recognizes that and is going to support me, am I going to be more likely to apply for that job? It says a lot about seeing people for who they are, that whole person approach, not just their skill set. And it can be a true differentiator for employees and employers. So here's the slide. As I've been talking about those turnover costs, I encourage you to take a look at this because, again, it gives you some real hard data. But let me also put this out to you. This is just for $60,000 a year, and this is for turnover. Imagine if this is for a key rainmaker, somebody on the executive team. How big is that number going to be? And there is another number that I can share with you. So this is more related to productivity. Somebody making $65,000 a year. Again, if they're going to suddenly have to spend 24 hours every week doing caregiving management, when do you think they're going to have to do a lot of that? When our doctor's office is open? When do they call the lawyer? When do they call Medicare, right? So it presents a real productivity problem. And so there is a real number that you can attach to that. Even if it's 15 hours a week during working hours that they're calling. And again, if you're caring for an older loved one, it's everything from mom, dad, the loved one, um, calling up at work. I can't remember my password. Do you remember if somebody's coming? Somebody that starts to get memory loss, you start to get those kinds of calls too. Again, everything that we focus on is to help reduce that time and cost, so that there is not this choice between your career and caring for the people that you love. This is more of the HR discussion. So I don't know how many of you are using this expression. I've seen a lot in HR, and you may have seen it as well. But this idea of what is the value of this total rewards program? Are these benefits being used? And is it something that they're going to value? So a lot of that has to do with the education and the rollout of any benefit, and then ongoing education to make sure that that the value is really seen. And it's something that I am deeply passionate about after doing probably, I don't know, maybe 200 open enrollments with all different types of companies. I think the one big thing that is most important with any new benefit like this is making sure that you're educating in the right way so that people know when and how to use it. And going back to that slide, this is really an intergenerational issue. So it's important to think about this, whether that caregiving person is 25, whether they are 45, whether they are 65. The stress of doing it is all about the same, but what they may need and how they need to be supported may be a little bit different. We also need to really emphasize the idea of getting prepared for caregiving. Similar to what I used to talk about when I was in the benefit space, right? We look at these claims numbers, and we all know they're lagging indicators. Nobody got cancer yesterday. somebody develops Alzheimer's, right? It didn't just suddenly one day we didn't have it, now we have it. Their diabetes is not something that happens in a day. Similar kind of numbers and thinking process through this caregiving challenge. When we can help these caregiving employees or potential caregiving employees be more prepared, it has a huge benefit. There are a lot of resources out there that are just going to look at it through the crisis lens. They are not going to look at it as a whole person. They are not going to dig deep enough to really understand and make a fit for them financially, financial output for certain types of vendors and services. And again, they may be handing things to those folks, but how is that employee going to vet resources? They don't have the expertise to do it. No matter how smart we are all experts in our own area, and caregiving and aging is a very, very complex system. And so having somebody that can bring the expertise to the table to make sure that whatever resource you're using is the right fit. It meets your budgetary needs. It meets your personal preferences and your family preferences. Um, and then how does all of this tie back into the policies that an employer may have? Tie into how information is actually put out, the communication strategy around that. And again, how is it integrated into that total rewards program? So it's not just a standalone, that it's actually enhancing other benefits. I dig a little bit deeper for our HR benefits people. I mean, all of us are familiar with FMLA, but we've seen employers out there that are still designating either half day or full day. I would encourage you to talk to them, particularly through a caregiving lens, of allowing people to take an hour of FMLA. And we live in a tech age. They may push back. It's so hard to track. Well, here's the benefit. If I can take an hour to go to the chemotherapy treatment with my loved one, or I'm not going to get dinged if the aide that usually takes care of mom is late, how much am I going to appreciate my employer? And how much more dedicated am I going to be to that job when they understand and help me balance those things? All of us know what flexible schedules are, and again, the ongoing discussion in the in the workforce and with leaders is, do we need everybody in the in a physical space? Do we want a hybrid? Do we care? But flexible schedules for caregivers is key. Things are unexpected that come up. There's no way you can plan for some of the caregiving challenges that are out there. Giving your employees that are caregiving more flexibility is a huge benefit for them, and again, helps them be more productive and helps them view their employer in a much better light. For those that talk to the legal teams at your employer groups, there is a growing issue around lawsuits. It's usually tied into ageism, but it's not a bad thing to talk about. Nobody wants to get involved in a lawsuit. So making sure that they're putting in policies and carrying them out clearly and communicating is very important. And like we all know, if we don't have management, middle management, senior leaders bought into what we put in terms of a benefits design, a new training program, whatever it is, we know it doesn't work. And one of the things that I am very big on is having these discussions with top leadership. Great way to help the entire workforce get educated is if you can get one of these top leaders to share their care story. It now becomes it's about all of us. I, as a leader, understand this is why we put this benefit in. And we really want you to not have to, again, choose between your career and caring for your loved one. Highlighting the dependent care benefit, as I talked about a little bit, again, through this lens of caring for an adult, I think has a lot of value, particularly if they already have it in place. And then some of your employer groups may have a backup elder care benefit. Not all do, But if they do, it's another thing I would encourage employers to highlight in the context of this conversation, so that they understand what it is. And then again, thinking about this kind of caregiving support and benefits, that there is a true time saving and what these financial costs are. Because the more we can show what the costs are, measure, the more we can show an ROI on this kind of support for caregivers in the workforce. Which gets us to my deep passion for this. As again, I've shared that I have the benefits background like many of you for many, many years, but because I have personally been through this multiple times, it is a deep passion for us at Motivity Care. It is taking this very fragmented world of caregiving and removing the complexity. And so this is what Motivity Care is. We are very honored to be working with Prestige to bring this to employer groups, to bring this to individuals, to make it easier for them. So it doesn't matter. Think about having one contact, one phone call to make, no matter what that caregiving challenge is. So again, mom didn't know how to protect the money. She's getting memory loss. Do we have any options to protect the money that she's saved? I don't know where to find the right kind of food service. I'm a busy executive. I can't handle the doctor's appointments for my retired spouse. My whole family is fighting over medical protocol. Do you have someone that is a true expert that can help us make the right decision for our family? Can mom age in place? What are all the pieces that we have to think about? Are there additional costs between setting up our house so that it's handicapped accessible? What else do I need to be thinking about? So it doesn't matter what the issue is. Again, as simple as helping with doctor's appointments, all the way up to complex navigating of financial concerns, legal considerations, medical protocols. Motivity Care is here to be that hub and provide you with the expertise. And the way we can do that is because we have more than 180 fully vetted resources across the country. So when people have Motivity Care and they get into these situations, we do an intake. You get a live person. This is not a bot. I'm going to tell you flat out. Because again, this is an emotional issue. If somebody's just gone through an accident, if they've just gotten that cancer diagnosis, we recognize that they need a human being to talk to first. And then we listen to their needs. And because of our expertise, are able to ask questions. When we go out and vet resources, it is incredibly important to us to make sure that we do the vetting for you. So we're going to understand your budget, personal considerations, locations, what kinds of insurance you have, all the pieces of the puzzle, so that we are going to come back with the 3 best, typically 2 to 3 best resources for your situation. And that means things like patient to staffing ratios, if we're looking at like a skilled nursing facility, infection rates, what are their overall ratings, just in terms of Google reviews, which may sound a little bit out there, but we also have people through our big network that go to a lot of these facilities on site on a regular basis. We want to make sure that that working caregiver has a much easier time figuring out what is the best fit for them, depending on the service or vendor that they need, which makes us a little bit different. We couple that with technology that allows you to keep everything at your fingertips. So for those of you that may be very well organized in caregiving, and yay for you for doing it, but a lot of people keep these things in folders, right? And so what do you do if you're on vacation or traveling and you get that tipping point call and suddenly you have to make some serious decisions? Do you go back and try and find a file? Do you get somebody to go to your home or wherever it is? And you may be a step beyond that. You may have put things in a Google Doc, or maybe you have it in Dropbox. And yay, again, good for you for getting organized. But there is a security issue around that. Our technology allows you to share down to a document or piece of information who sees what when. And everybody double authenticates, including my entire team. So what does that mean? Maybe you and your sister are sharing care for your mom. You put your information in here. We help you do that. And now, doesn't matter if you live in the same city, 2 different states, 2 different countries, you now all have access to the same information. But the aide going in to take care of mom that you may hire, you may only want that person to see specific medical information. You can do that. You want to be able to send out reminders easily. You can do that through this platform. You want to be able to organize information so you're not digging through a phone. Who is mom's housekeeper? Who cuts the lawn, as some examples. We even think about things like what would happen to a loved one's pet if they were in rehab for a month, 6 weeks, whatever that might be. It's really about seeing that person as a whole person and making sure that every piece of information is at your fingertips so that when you get that emotional call, you have the practical pieces in place to make sure that it doesn't turn into a major disaster, that things aren't missed in that emergency, and that you again can balance your career and the caregiving. But I think the other thing is to make sure that your loved one is truly protected. And so this is what we really advocate for. We need to be more proactive. I go back to saying, what do you have in place for yourself? What do you think your team has in place for them and their families? What do we think our employers are doing around this piece of the puzzle? Are we making sure that caregiving is being discussed and that they are aware that there is a proactive approach that can actually show an ROI if you measure this correctly? We take great pride in being able to integrate Motivity Care into Total Rewards program. So there is a whole educational and rolling out process that we do. We come with the expertise around the communications piece of it to help the employer put this out there in a meaningful way and also match their branding. Because as we all know, like that employee doesn't care about Motivity Care or really probably any of the other benefits, like in terms of who it is. They just care that they get the help. And so we're very, very big on that education piece, both from the beginning, but also ongoing. I'm really pleased to announce that everybody that's on our platform is going to have access to our ongoing new webinar series. So these will be on specific areas of caregiving. Simple. Do I know the difference between having a will and what is a trust? As an example, financial considerations for female caregivers, because again, that might be of interest to certain people in your world. We're very lucky to have so many good partners, including Prestige, obviously, and it is this mission to make it easier. And we shared a couple of our testimonials. We are honored to be able to help these working caregivers. We are honored to make it easier for them to protect their careers and be there for those people that they care about. Many of us will be caregivers. And many of us will have to make caregiving decisions at some point in our career. And so this recognition that we are your employees, we are your leaders, we are your innovators, and we bring a lot of value to the organization. And when we have the support that we need when we go through these caregiving challenges, we can be productive, we can be those creative problem solvers, and we can have the resilience to help our companies grow and stay competitive. So I thank you so much for your time today. I hope that if any of you are going through caregiving right now, that you're first taking care of yourself and that you know that you have a resource. And we are greatly appreciative to Prestige for the opportunity to talk about this. So I'll turn it over to you, Carrie.
Yeah, that was so great. Thank you so much for sharing that. We really appreciate that. I didn't see any questions come in through the chat, so that means you covered everything, which is awesome. So thank you again, and we appreciate you taking the time for us. A recording of this webinar is available on our website at prestigepeo.com/webinars. If you have any further questions, feel free to contact your benefits specialist. And don't forget to check your inbox for our monthly Insights newsletter, delivering the latest HR news. Connect with us on Facebook, LinkedIn, Instagram, and Twitter for the latest information on Prestige PEO. And lastly, don't miss out on our Prestige Go mobile app, which provides access to benefits information, on-the-go support from your HR team. Thank you all, and we look forward to seeing you again next time.